What is going on, you guys? Madam Roast Beef here, and this is probably my biggest update since I found out and was diagnosed with brain cancer. I don't know whether or not to be like overjoyed or like just totally just a nervous wreck. I got a lot of news regarding, you know, the type of tumor I have, how we're gonna go forward with my, form of treatment, my treatment plan and all that. And I actually had a friend who went with me to the appointment and recorded like the doctor explaining everything. So I'll have footage. I'll let him do all the technical stuff because I don't know. I mean, I have like a good idea. What's happening is my tumor is actually clogging up my right ventricle in my brain, and that is causing fluid blockage. There's some fluid getting through, but if I don't do surgery immediately, they're gonna have to put a shunt in my brain to allow fluid to pass through. And that's not good. The doctor said it was very rare. He says he hasn't seen a tumor like this in years, which is, I don't know about you, but like when I associate rare with like a life-threatening disease, it's usually not a good thing, right? I'm happy no matter what. Like even if hearing that, oh, it's rare, you know, it's not good, we gotta operate immediately, I don't give a fuck. Like I don't care. I'm ready to get this out of my body. I am so beyond prepared for this to be dealt with and over with, so I can go back to being like the smiley, healthy, honey, healthy, you know, person that I always am, because I don't have time to sit here and, you know, worry like, oh, is my life too short? You know, I don't care. I'm gonna live life and I'm gonna enjoy it for as long as I can. You know, no matter what happens, I'm keeping my head up, and I'm a fighter. You know, I'm not going anywhere. I'm gonna be here for the long run, right? And I couldn't have this, you know, strength and positivity without you guys. So I want to just first off say thank you to everybody for always watching my videos, for commenting, coming to my live streams on my channel. It means so much to me. You guys are my family. When you support me and you just share my channel or you subscribe and all that stuff, it genuinely, it just puts the biggest smile on my face and gives me the most heartwarming feeling I can even describe. So I love you so much for that alone, and just for always being here and giving me this outlet just to talk whenever I need to. It means so much. So surgery is coming. I'm seeing one of the best doctors in the world, which is like, yes! That's super exciting. I'm gonna be doing surgery hopefully at the Stanford Institute. Insurance is trying to give me, you know, trouble, and they said they're gonna send me to Utah, and I'm like, you know, Utah's beautiful, but like I'm not taking that 1% chance that I could die in Utah. I'm not taking that, so fuck you. We're gonna go to where my doctor said. I actually saw this doctor originally. I had part of it in one of my long vlogs where I went to his office, and or maybe I didn't. Maybe this isn't a vlog that I haven't put out yet. I have a bunch of footage from 2 months ago. I'm really bad at vlogging and putting vlogs up, as you know. It's just that when I do things, they're so spaced out, but I actually have a huge support system now. There's a bunch of like moms and other families from the cancer organization that I'm seeing that are just super cool. You'll see, I actually went to the appointment with my friend Edith from there. She is such a sweetheart. We've been hanging out like every day. I'm thinking about moving out of this apartment, so like lots of good things are happening. If you haven't watched my live streams or anything like that and you don't know what's going on with my life, lots of good things are happening, you know, aside from brain cancer. I'm staying positive, I'm keeping my head up, and I am being a feisty fighter son of a bitch, you know? But here, I'll put the footage right here of what the doctor has to say, and I just want to tell you, no matter what happens, no matter the outcome, I love you, and I'm so grateful for you, and I have no idea what I would do without you. So this is an uplifting video. I'm getting surgery. Whether, you know, some of the news we got is, whether you see it as good news or bad news, at least it's news. You know, I've known for 5 months, and I'm having headaches every single day, and I'm not puking anymore thanks to THC oil. Right? So good things are happening. I'm in a lot of pain constantly, but I'm sort of becoming used to it, and it's not affecting me as much as it usually does, you know, or used to. So yeah, here's the footage from the doctor. I'll let the doctor explain it, and I will keep you updated on when the surgery is and where it is. You know, I might have to actually take, you know, once I do the surgery, recovery time, I might be like off of YouTube for like a week or two, but I'll still be posting videos, and I'll even do like short hour live streams no matter what, just so you guys can see kind of the recovery process and all that, just so I can share this journey with you like wholeheartedly. But I love you guys. Here's the footage. Leave a comment below. Make sure to subscribe. That really does help your girl out if you want to like see my journey and share this with me. You guys are my family, and I need you here by my side. I love you. Here's the footage from the doctor's office.
The brain has some big pockets on the inside we call ventricles that are full of fluid.
Yeah, isn't it in the left ventricle or something like that?
It's in the right one.
Oh, okay.
This is left, this is right. This is brain substance, front, back, right, left. That's the tumor right there.
Oh, that's
so
terrifying.
The good news is it's in an area where there's fluid. That's why it's not hurting your brain much. In fact, probably not hurting your brain at all.
Okay.
The problem is the ventricle should look like this. This mass is partially plugging up the outflow of fluid, so this ventricle is bigger. That's probably why you're having headaches and nausea. I say it's partially plugging it because if it totally plugged it up, this would get massively ballooned out. There's obviously fluid that gets through by it,
yeah,
but it's gotten to a point where it can't get, it just kind of seeps by it. Dr. Lasky's request said it was a grade 2 glioma.
Okay.
A glioma is a tumor that originates in the brain and doesn't come from somewhere else. And it will more than likely continue to grow.
Yeah.
In fact, by definition it will if it's truly grade 2. I don't have the path report to prove that, but assuming they're correct. And if it continues to grow, it's going to plug off the flow and you're going to get bad headaches and have to have a shunt placed in here, which is just going to bypass the fluid. That tumor needs to be dealt with.
Yeah.
This is beyond what I can do here, all right? There are doctors that can go in with a scope, which much less invasive, or if they can't be done that way because it's too big, generally a center of excellence like UCLA or Stanford. Now, I'm part of Stanford, and I've already sent your pictures up there to get an assessment.
Okay.
Because getting out as much of this as possible is the goal.
Yeah.
Sometimes you can't take the whole thing out, but sometimes you can.
Yeah.
And I think being at a place where they do this much more routinely, these are extremely rare. I haven't seen one like this in years.
Okay.
Yeah, biopsy is simple compared to taking it out.
Yeah, right.
So
first off, I want to say thank you because like all the doctors I've seen, nobody has actually had this in-depth conversation with me. So thank you in advance. Like, and I've known for 5 months. So yeah.
Wow. I've sent these pictures to Stanford University, which is a center of excellence for sure, and I'm faculty there. So that makes the most sense to me because I am part of that faculty, and we can get you up there ASAP and get it dealt with.
Okay.
When something is above and beyond the expertise of what we can offer here, I think it's reasonable to at least make the request.
Yeah.
They do have a center of excellence. I know they will more often send patients to UCLA than Stanford. But since I'm part of Stanford, I'm not sure it would make any difference where you go.
Yeah.
But I don't know for sure.
Okay.
Rules change a lot. So I don't think you're in any immediate danger right now because your exam is pretty darn normal.
Okay.
But the fact that you're constantly have a headache and nausea,
it never goes away.
it's because you got this back pressure, and the optimal treatment would get as much of that out as possible.
Yeah.
And open up the normal flow of fluid through there versus doing an implant and just bypassing temporarily.
Yeah.
So I've already got she's got the ball rolling in that direction, and we'll just hopefully can get an answer sooner than later.
Yeah.
And if you could go to Stanford, that would be a lot. It would be optimal for me because it's part of my faculty and I know them well.
Well, it's probably a better facility too.
They're both way high up there.
Yeah. Because I heard that you were one of the top doctors in the world, so...
World?
Yeah. That's what I heard. So as soon as I heard
You're
that...
known in the cancer community.
Yeah. As soon as I heard that, I was like, oh, I'm switching my insurance. I don't care.
Wow.
So...
Well, no matter where you're rated in the world, there's certain things that...
Well, already you've given me...
limits.
Yeah.
There are neurosurgeons and centers of excellence that all they do is this.
Yeah.
Like, I don't do pituitary tumors anymore because there's people that do it far better than I.
Yeah.
Because they do it every day, all day. I'm still a general community neurosurgeon, and I like that. I do pediatrics, I do adults.
Which is cool.
I do brain, I do spine, but about maybe I'd say 10% of what comes through is beyond what I normally do.
Yeah.
Though I could do it.
If there's somebody that can do it better.
For optimal outcome,
Yeah.
I think I owe it to you to try to get you to a place that I know would probably do
That's awesome.
a better job.
Yeah.
And not that I couldn't do a perfect job. The thing is, if you do something every day versus once every 3
Right.
or 4 years, come on, just logically,
Yeah.
it makes sense to attempt to get to the place that this I want. So let's go talk to Dee. She'll give you the update since I've spoken with her. We'll give you that CD back. Actually, we might.
If you want to keep it, that's fine.
Well, we might keep it because if they tell us Stanford's good, we'll send it there.
Yeah.
If they say UCLA, I know the head of UCLA there. I know her very well. She's amazing. She was one of the only. I think there's only 2 women neurosurgeons head of departments now in the country, and she's one of them. Linda.
Oh, wow.
We're about the same age. She's awesome. So the benefit to Stanford is just because I'm faculty there, but
Yeah.
I know both places have far beyond what we have here, at least to my knowledge, and that's probably why Dr. Smith didn't pursue it at all.
Yeah, he was.
It's unfortunate that I didn't even talk to him.
No, didn't even call me back. His office wouldn't answer the phone, so that's why. And then because he works at UCMLA or not UCMLA, UMC, he had a lot of like other colleagues in the area, so they all would tell me, just go back to Dr. Smith, go back to Dr. Smith, and I was like, I'm telling you, I don't want to. Like, you know what I mean? So.
All right, I get it.
And in the spot that it is, I was told that the tumor is near like motor skills, so it's kind of a dangerous surgery. Is that true?
No, it's actually in the fluid itself, and it's not affecting your motor skills at all.
Okay, good.
I wouldn't expect it to, based on your exam and not looking at it.
Yeah.
Getting to it, on the other hand, is where you might affect motor skills.
Right.
Depending on how invasive they have to be. It looks like it's growing from the wall, and because it's in the ventricle, you probably are a candidate for them making a small incision, going in with a scope, and not having to go through motor skills area of the brain.
And that they would go like through the top or whatever?
Usually off.
Because I know
side
the biopsy they did here.
Yeah. So it may be a similar approach,
Yeah.
but without having to make without having to disrupt the brain as much. Sometimes they can't do it that way, but I think we need to find out what they think. And, what's your availability if they want to?
I work from home, so.
All right, so if, for example, they said they agree it needs to come out,
Yeah.
it would probably be to your benefit to just make one trip.
Yeah.
To plan to see them, to confirm that, set a surgical date, and have it done.
Yeah. So I work from home, so that's not
UCLA or Stanford.
a big deal.
So we'll just wait for Dee to get some answer from Medicaid
Okay.
as to what they're going to do, because they generally won't direct. But it'll be one of the other places, I think.
Yeah.
Unless they want you to see a third neurosurgeon here, but I don't know anyone that does tumors like that.
Well, and I've already seen, like, before I switched to my insurance, I saw Dr. Smith, I saw one other doctor, and then I saw one other that said he wouldn't even treat me without giving a reason. So I
looked at the tumor.
Yeah.
Was it a neurosurgeon?
Yeah, it was. Yeah, so I've literally been kind of getting the runaround, so, like, thank you for today. Because
like he hasn't had any answers to it. When I met him, I'm like, what do you mean you haven't done anything? Or
no answer. All they've done is given me like nausea medicine. Yeah, right. Well, and for me, I know my mom's friend back in Ohio. She was like doing a bunch of research, and she said that she found out that you were like one of the best doctors. Yeah. Well, and she said that, and I was like, oh yeah, I saw him. I didn't realize that. Like, he was one of the best doctors, like, there was. So I was like, if he's right at my doorstep... Well, like, if he's right at my doorstep, nothing's gonna stop that. You know what I mean? That's just wild.
Maybe that's why you're here.
Right.
What if this happened in Ohio?
Right. Exactly.
Jeff, being a good doctor is there's a lot involved with that. But you're right. At least making the patient feel like they matter on some level and have some level of understanding. Most people
and like just you've been engaging with me
what
too.
What it is and what your options are.
Yeah. So just left the doctor. Literally just shook. I don't even like know how to put into words what I'm feeling. So I found out that the tumor is not exactly what I thought it was. I mean, it pretty much is, but it's a little bit of a rarer.
It's a GBM.
Yeah, so that's not good at all. And it's blocking like one of my ventricles, and he said he hasn't seen anything like that in years. So I'm probably gonna go to either UMLA or whatever it is.
UCLA.
Whatever. UCLA or like the Stanford Institute. One's in LA, one's in San Diego. So it just feels so good. Oh my God, it's just so relieving to like finally be getting, you know, progress and like some fucking information. Like he sat me down, pointed at it, showed me where the diagram was. Nobody's done that. Nobody's given me a goddamn little bit of information. So that was amazing. He was really cool. We filmed some of it, so I'll probably put some of that in there if I can. And I love you guys, and I appreciate it because I know you guys are like my biggest support system in terms of my existence and like just everything. So it means a lot, and I could not do this without you. So thanks for being here on this journey, and thank you for coming with me today.
Of course.
Because like I said, I've been going to all my visits alone, and it was so nice to have her with me today.
Coffee.
Yes, got me coffee in the morning. That's what I'm talking about. I love you guys.